Welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, so we want to answer them as many as we can, and there are a lot of questions, so let's go quickly. One of the main reasons people have grown leery of vaccinations is because the whole truth wasn't being told for so long about what's in vaccines. If medical professionals quit dancing around the issue and directly talked about whether or not metal additives such as thimerosal is in certain vaccinations, it would empower them to make informed choices. What's your response?
You know, I think as they've taken this stuff out of them, I think that autism rates have stayed the same, and that's always been the fear.
Right, and it's basically a very, very low dose of something to preserve the vaccine so it doesn't deteriorate, so make it safer. And it's about the same amount of mercury as you'd get if you have a can of tuna, right? I mean, it's...
But they took it out. And that's one issue as we go back and forth. We're answering it both ways. You know, we're saying, oh, but it's safe, and oh, but it's not there. And that's where some of that comes from the public. Just like the ingredient they were, in which, you know, that they were worried about causing autism and whatever, they took it out. But then which some would say led some credence to, well, then what was wrong with it, you know? And so, unfortunately, but they did it because they didn't want people to have to worry about it.
Right.
You know?
Yeah, and that's the point. Although, do you think that we're 100% informed and 100% uninfluenced in the, I mean, do we ever dance around any topics? I mean, are we 100% honest? I mean, I try to be.
Honest but informed is the question. I mean, boy, we can't know everything about everything.
What in medicine is 100% anything?
Yeah.
Yeah.
You know?
So I think, you know, all you can do is ask us to try to do our very level best. Be honest, be kind, and respect people's choices, you know? Via email, I've heard a lot about elderberry syrup supplements. Is this safe for children in regards to colds? And does it make a difference? Safe?
I have no idea.
Yeah. Just because it's natural doesn't mean it's safe. And most of our drugs come from natural things, really. It's just
Really?
because we just studied them a ton, and that way we know they're safe.
Yeah. How contagious is shingles?
Not very.
Not very.
If you open up the blister and touch somebody who's never had chicken pox, then there's a chance to pass it on. If it's covered, boy, it's not very contagious.
Yeah.
But you can't get shingles from someone who has shingles.
You're right. That you can't get shingles from somebody who has shingles.
Yeah.
You get chicken pox from somebody who has shingles.
So shingles are what? I mean, chicken pox, but now only in a nerve?
It's the chicken pox virus that comes out in a certain area of the skin.
And it's been sitting there for...
Sitting in the spine forever.
Okay. Please discuss C-reactive protein.
It's an inflammatory marker. It's not very specific. It can be used for looking for infection. It can be used for looking for cardiac disease. There's other things that can be looked for too. And so if it's high, we don't necessarily know what's going on.
Yeah. I'll be honest with you. We had a SED rate when I came along, and they said SED rate. It shows there's inflammation somewhere. It goes up in about half of all the diseases we have. It's not a very good marker. It doesn't tell you much.
It's not specific enough.
And that's what C-reactive protein is. Yeah. It's the same thing. It's just an inflammatory marker. Don't make anything of it.
Yeah.
But if it's normal, it can be reassuring.
It can be.
Yeah, but if it's not normal, then you go, well, something might be happening somewhere. That's a normal, it's sort of like, what is it, the test that we use for pulmonary emboli? A D-dimer. When the D-dimer is normal, okay, you don't have PE. If it's elevated, well, you might, but you could have a million other things. 83-year-old woman has frequent urinary tract infections, always empties her bladder. How can she prevent future infections? Any specific foods or fluids? I like vitamin C, and I tell them 4 times a day, and I think it helps. What do you think?
I think it's reasonable to do cranberry juice, too.
Oh.
Yeah. I mean, there's sometimes surgical options, there's sometimes medication options, but...
I think you need to be tested and checked, and maybe there's a problem that's causing infection.
Sure.
81-year-old daughter has malignant hypothermia. What's that?
81-year-old?
81-year-old daughter has malignant hypothermia. What is it?
Well, it might be malignant hyperthermia, but it says hypothermia.
Yeah,
right?
but I think it's malignant hyperthermia. That's what it is. A person who goes to anesthesia and their temperature
Right.
It's too high.
So you got to be careful going to anesthesia.
Yeah.
That's the key. Anything else to know about that? Malignant hyperthermia. Pancreatic cancer survivor, healthy sisters dying, having something. Likelihood of children of getting cancer to watch for. So that's the question. Cancer history, cancer of the pancreas history, does that mean there's a risk of cancer?
Yeah, I mean, that's the fascinating thing in medicine over the next several years will be being able to test for some of these genetic causes of cancer that run in families. And we can do some of those tests now based on the history, and we're going to be doing a ton more in a short amount of time.
Right, the genetics, for example, the genetics for prostate cancer. So you do prostate testing, it's abnormal. Do we worry about this cancer? There's a low-grade cancer in your case. Do the genetic test, they're thinking this is right around the corner, it's not here yet, but not ready for prime time.
Yeah.
But then you go, no, this is this smoldering kind of cancer probably in your family. You're likely not to have the bad kind.
Yeah.
Let's just leave your prostate where it is.
Sure.
But there's plenty of cancer that has nothing to do with your genes either. So.
Right. Yeah, so the answer to that is maybe, maybe not.
Yeah.
Maybe you have to be married, maybe you don't.
Boy, doctor, you're so wishy-washy.
Yeah, I know.
Dr. Rick, which is more infectious, measles or Ebola virus? And what is the difference between an airborne infection and a bloodborne infection? Okay, so what's the difference? What's more infectious?
I'm guessing measles would be my guess.
More infectious than Ebola.
I think if Ebola was as infectious as measles, all of Africa would have Ebola.
Yeah.
Well,
That's
the
my
whole
opinion.
world. It would have.
The whole world.
And that's what
Yeah.
they're worried that if it were to develop that
Yeah.
type of.
Right.
And so that's part of the reason why they're just scrambling as hard as they can to get a vaccine.
Sure.
Yeah.
What
What's the
about
rest of it?
airborne versus bloodborne?
Well, when you get in respiratory by breathing it in, whether someone coughs on you or it's hanging in the air or it's on a surface, and like measles, it can be you can leave the room and 2 hours later someone can get it. Whereas blood, where you need to be in contact with the blood.
fluid, like HIV or hepatitis
Or
something
Ebola.
like that. Or Ebola.
Yeah, see, so measles, airborne,
Yeah.
Ebola, bloodborne.
Yeah.
When should a COPD patient slow down and possibly enter hospice? Patient enjoying life, walking, but how much longer will this last until it goes downhill? Ooh.
It's hard to say.
Do it while you can.
Walk as much as you
I would say
can.
walk as much as you can, enjoy life as much as you can, stay as active as you can, and your lungs will hang in as long as they can.
I think when it looks like you need to be on a respirator shortly,
Yeah,
that might be the hospice call.
sure.
I do think that there's a time when a person who has COPD and is really compromised, but still active and doing fine, don't need to say hospice, but they can make an advance directive that says, I don't want to be intubated.
Yeah.
That might be what I would do. Nursing home care would like the doctors to address how middle-class families are supposed to afford elderly care, nursing home care.
Yeah, I mean, of course, you can get into insurance and everything else, but
It's difficult.
Yeah.
It's difficult financially for caring for an elderly person.
Yeah.
It really is.
I will give you my answer. My mom used up all the savings that she had.
Yeah.
So I wasn't going to inherit anything from her because she was in the nursing home. She used up everything she had until she cranked it off
Yeah.
until it was all gone. And then I had to buy the lake cabin, right? Didn't, paid her for the lake cabin, had spent all that.
Yeah.
Then she was eligible for Medicaid.
Yeah.
And she had Medicaid for half a year.
Yeah.
And I think you have to, if you don't, you're not responsible for when they run to the point you just let Medicaid kick in. I mean, live your life, let your mom. I'm not a fan of the insurance.
Not a fan of the insurance.
How about what can the 87-year-old caller do about restless leg syndrome?
So there's certain medicines that we can take to help settle them down a little bit. I think I've found people that are more active seem to have less trouble with restless legs.
Stretching at night,
I think
be more
stretching,
active, and then there's the Mirapex and the anti-Parkinson medicines that help.
Yeah.
Cinemet's the only problem in Cinemet sometimes drives it.
Yeah.
It's a tough one.
Yeah.
Would docs talk about celiac in newborn babies? Great-granddaughter is having issues.
You know, my baby girl had some issues, and we tried you got to try the milk-free for a while and dairy-free, and maybe even try and then they grow out of it, and it probably wasn't celiac or anything maybe it was just colic, who knows. But when you're in that position, sometimes you do everything you can, and if it seems to help, you do it. But
She grew out of it.
yeah.
I mean, the irritable gut, some little kids get irritable gut, don't they? What do you suggest for irritable gut? Do you give them molasses or
No,
milk-free,
I don't do
or
a
you
lot
go
of
through a
it.
series of things?
Patience and earplugs and warm packs to the belly and lots of comfort. It's
Yeah.
hard.
It's hard.
That's a hard one.
What do these physicians think of steroids for children with asthma, and do we need to worry about side effects?
Well, we try to minimize it as much as we can, but if they're in an episode where they're having trouble breathing, they need the steroids to help save their life.
Right. Go inhaled as much as you can.
Yeah, yeah. I'd say avoid the oral stuff as much as you can, but like you said, sometimes you need them.
Or they're dead.
You need to breathe.
Or, yeah.
Yeah.
There's a nice thing about breathing, you
Yeah.
know.
And then get off of them.
And then get off of them.
Yeah.
Parkinson's disease, 5 years ago, came down with it. No symptoms yet, but what can I expect? It varies.
Yeah.
My answer to that is some people do very poorly. I mean, over time. Some level off.
Yeah.
But the best they do are the exercisers.
Right, yeah, I was going to say.
Right.
You know, people, it's a movement disorder.
Yeah.
Get moving and
Therapy,
stay
therapy,
moving.
therapy.
Yeah.
Yeah, use it or lose it.
But if it gets bad, you can expect that short shuffling gait. You can expect to lean forward a little bit more. You can expect some tremor, some forgetfulness potentially. All possible.
It depends upon the person.
Yeah, it really does.
Yeah, it can change. Well, let me put it this way. And then we're all going to die.
Yeah.
So there you have it. What do we expect at the end of our life? It's going to happen. Advice on signing up for health insurance. He's got pain in his foot and can't see a doctor without insurance.
That's what the new health exchange is for, I
It's
guess.
supposed to help, yeah.
Yeah.
So I'd say, log on to the government website and look at the best options for you and
Get it?
go ahead and, get it if you can.
Yeah. We should all encourage people to do it. What causes nighttime sweating early in the night?
There could be many reasons. Sometimes scary reasons, sometimes nothing. I mean, so is it a blood cancer, or is it hot flashes? Is it menopause? Is it,
A low-grade fever from tuberculosis or from a little nail infection?
Or is your room too hot?
Or
yeah.
it could be a lot. I'm old enough to have had all the childhood diseases. Since children have been getting the shots for 60 years without widespread problems, isn't that proof enough that they're safe? I think that's really true. There's a lot of proof that it's safe, and I think she's just saying, isn't the fact that they've been getting shot for 60 years? Think about all of the improvements. I think the studies show a great improvement. Why are family and friends hesitant or avoid spending just a few minutes with old friend or old relatives?
I want to go back one more time with this because
Okay.
I mean that's the problem with my generation is that we didn't see the floors of kids with polio and the neighbor children and other people with paralysis, and we didn't see all the measles and the deaf, dumb, and blindness that came, and
It's kind of taken over the show, isn't he?
He has. I mean, that's right.
yeah, hammy though.
So, but that's really true. I mean, I think the fact that my mother sweated polio and she wept the first day the polio vaccine was available to me. She wept and she carried me to the doctor.
Yeah.
Family spending more time with old friends. People are afraid to spend time with the older people. Sometimes they're afraid to spend time with the people dying of cancer. Why is it? Younger people are less willing to hang with old guys like me. I mean, what is the problem there?
You know, I don't know. I don't. It's maybe a philosophical type of thing. Maybe they don't like to see somebody in that state. Maybe that makes them uncomfortable. Maybe they have a fear of death themselves. Boy, it's hard to say.
And people are busy,
Yeah.
and that's a dumb excuse.
Yeah.
But they live their lives, and you know, it is important to make time to do those things.
And you know, it used to be that older people sometimes had an odor. And if I were an older person and I wanted to have visitors, I would make it springtime in Febreze, and I would have fun, and I would not demand that they come and visit me more, because if you want them to go away, demand that they visit more.
And sometimes people can do more to go out themselves and interact with other people.
There's a ton of people at our community life center and our community. What is it? They have activities at the community. I've forgotten it, but there's it's that. It used to right next to the library downtown. There's tons of activity going on in this town. Senior citizen
Activity center,
senior activity center. 75-year-old got vaccinated when she was a young child, and is the vaccine still good? Depends upon what kind of vaccines.
Yeah. But there's a good chance it probably has some efficacy. But there's a chance it could be.
I think they could use it some more.
I mean, generally, we're anyone born before 1957, we're not recommending you need to worry or think about getting a new MMR vaccine anyway for measles. So.
57? I'm trying to decide if an 88-year-old woman should get the shingles shot. One doc has advised a blood test first to check the immunity to shingles before going ahead with a shot. Is that what should be done? Are you checking shingles vaccine immunity? Shingles immunity? I'm not.
Just give it.
I'm just giving it.
Yeah. Yeah, I don't check anything.
No. I'm recommending it for people 60, actually 65 or older.
Yeah.
It's a little spendy. Most insurances are now covering it.
Yeah.
When I had it, I had to pay the whole thing.
Yeah.
And then they cover it, I think, a month after I had it. How come insurance won't pay for shingles vaccine? But it will. It depends
Yeah,
upon
it
the
will.
insurance, though. It's getting better.
Some will.
Because insurance companies are trying to save money.
Yeah.
Yeah, it's a mistake. Caller had a measles shot in the 50s and feels that vaccines were not questioned. Why are people more resistant now? I mean, and the question is,
Because we have internet.
It's the internet.
That's it. We have a lot more. There's a lot more questioning. There's a whole lot of media that. I mean, in the 50s, they didn't really.
they just said, the doctor, I trust the doctor.
Yeah. And there weren't stories of, you know, people expressing concern and fear and that type of thing, which.
Which is rampant.
Yeah.
And a lot of these people are great, good people, but it is a little bit of selfishness too. That I don't want to harm my children or protect my neighbors.
I think there's a, and they may be harming their children, so
Right.
that's the truth. I'm a physician, 14 years, this is the last question. Physician, 14 years out, and do not remember any training in talking to patients about end-of-life care. I'm an emergency room trained physician, have had this conversation so often at times of emergency instead of when it could have been a time when it was earlier and made more options available. That said, it's often a discussion of do not resuscitate, which is interrupted as do nothing, or is interpreted as do nothing, versus what it is intended to not do aggressive care. I would encourage training while in medical school and continued competency training in this, also to include palliative care options in these discussions. Thank you, Scott. My question to you, both of you is, did you have training in end-of-life, talking with people about end-of-life care and this kind of questions?
As a medical student, we had a fair amount, it felt like.
So it's changed.
Yeah, it's changed. They're making it part of the curriculum. Is it enough or not? You know, part of it you just have to, the practice of medicine and learn as you go.
I think the most important issue that I shared with the Parkinson's group today about about advanced directive, and I think is that it really not that important of a legal document as it is a communication tool with your family. Talk to them about how you would, if you lost your ability to know who your family members were, what would you want or not want? You agree with me on that?
Yep.
Thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. And until next time, stay healthy out there, people.